This is the Best Health Podcast, brought to you by Wake Forest Baptist Health in partnership with MedCost.
Good day, everyone. I want to wish everyone a happy and well new year. This is Justin Gomez with Wake Forest Baptist Health, and we are recording our first ever Best Health Podcast. So we're excited about the new year and some new ways that we're talking to our local community about wellness from the Best Health community team and from Wake Forest Baptist Health. We have a very special guest for our first ever podcast, Dr. Jamy Ard. He's from our weight management clinic, and he is going to be talking about a variety of topics around weight management, getting healthier, and a lot of us, we're just this yo-yo. It's hard for us to lose weight for one reason or another. And I think Dr. Ard's going to enlighten us on some really interesting information and facts and encouragement about the overall topic and some of the services that we offer here at Wake Forest Baptist. So welcome, Dr. Ard.
Thank you, Justin. Glad to be here.
Thanks. So just to start off, tell us a little bit about yourself. At what point in your life did you realize you wanted to be a doctor, and take us from there?
Yeah. So I grew up in Louisiana, small town in northern Louisiana called Grambling. Grambling State University is the place that I grew up. Most people don't realize there is a town there. It's not just the college.
Right.
And I had the fortune of spending my formative years there, but decided to leave once I went to undergraduate school. I went to Morehouse College in Atlanta, and then matriculated at Duke for medical school. Don't hold that against me.
I'll try not to.
But that's where I really sort of got interested in weight management, because when I went to medical school, I was really anxious to say, hey, I want to fix some stuff, right? That's why I wanted to be a doctor. I thought I was going to be a doctor all my life. So here I was. Now I'm finally learning about what doctors do. And I was like, I want to be in the line where, you get in there and you fix something and you're done. And you see people, do better as a result of the things that you've helped them with. And so, to me, that was like, okay, I've got to be a surgeon. And then we started learning about different things that, chronic diseases like diabetes and high blood pressure and high cholesterol and heart disease and even cancer and those types of things that you learn about when you're doing your pathophysiology. And the first thing that everybody was saying was, hey, tell people to, live a healthy lifestyle, right? That's the first thing that you want to do to deal with any of those diseases or prevent them.
Sure.
And this was in the early 90s where people were just starting to talk about obesity as an epidemic and really, starting to think about, more people are gaining weight and we're seeing more obesity. And so that got me really interested. And then in a small group team that we had, one of the clinicians who was the director of the Duke Rice diet, Bob Rosati was his name, he took us to that clinic and let us talk to some of the patients there. And that was just eye-opening for me to see with this type of intervention where they were helping people, basically engage in an intensive lifestyle intervention, that these are folks who were coming in wheelchairs and leaving, walking a mile.
Yeah, sure.
Right, and doing that in a very short period of time. It wasn't that they needed years to do that. That was something that was happening in, a month or 2 months. Mm-hmm. And that was really eye-opening, and it was inspiring. And I felt like, of all the things that we've been learning about, this is something that reaches across a number of different health conditions and affects everybody. No one's immune from the challenges of having to manage your weight. And so it went from there, and that was very early in my medical school career, and that's what I've been doing all my life now, so all my professional career.
That's pretty cool.
Yeah.
So how long you been at Wake Forest Baptist Health?
6.5 years. So my family and I, we came here in 2012.
Okay.
Yeah, so it's been a good run.
So when you're not being a doctor for us. What do you like to do with your fam in the spare time?
So I got a couple of teenagers, twins that are 15-year-olds now.
Twins.
Oh man, I'm having a flashback now. Sorry. Those first few days are tough, but no, they're great. And so like everybody else, we're running around. At least we're still playing man to man because we only have two.
There you go.
But they're into their extracurriculars, and my wife is a wonderful woman who takes care of all of us, and make sure we're all organized. She's the coach on the team.
There you go.
And then when I've got some free time, I'm trying to play some golf. So that's pretty much it.
There you go. There's lots of good courses around here.
Yeah.
So we're going to get into more details about the weight management center and medical weight management here in a few minutes. But I just kind of want to get a response from you, first of all, just in more broad strokes. So we are inundated with so much information these days. When I say we, as a consumer, as a potential patient or a patient, there's so much information coming at us from social media videos to late night infomercials, and there's so many quote unquote lose weight fast, this will change your life, just use this machine for 8 minutes and the fat will melt off, and these pills that you can take that are wonderful supposedly according to these commercials or videos we see. So just I guess speak broadly from just how that is a potential challenge for us as a consumer, as a human being, with all this different messaging. How is so much white noise, and how does that present a challenge when you speak to potential patients coming in that they've heard all this messaging? What is true? What is not true? If you could talk to that for a second.
Yeah. So now this is going to take up the rest of the podcast. Because you're right. I mean, we get lots of information coming at us on a regular basis about, do this, don't do that, this recent fad diet, that new thing that people are avoiding now, like you can't eat carbs, or you can't eat fat, or you only can eat avocados but on whole grain toast, or right. I mean, who knows, right? And so. And then the other challenge is everybody has an experience with food, right, and with physical activity, and with their own sort of story around a healthy lifestyle endeavor. And so that means everybody's got an opinion, everybody's got their sort of perspective and take on it, which is totally different than any other area of medicine, right? Mm-hmm. I mean, if you've got a knee that needs to be replaced, you don't go into the orthopedic surgeon and say, hey, I want this model of knee.
Sure.
In this procedure, you don't tell your cardiologist put this particular stent in. But when it comes to weight management, a lot of the care is really sort of in the patient's court. And there's some challenges to that because, a lot of times in this space, we have people who are well trained and been doing this a long time and have a lot of experience in terms of understanding the physiology of obesity and body weight, and the benefits and risk of pharmacotherapy and different dietary approaches and physical activity, and how to integrate all that, the behavioral health aspects of it. So it's a really complex sort of set of behaviors, and people tend to want to boil it down to just one thing: I want to lose weight. But it's a complex system of hundreds of different behaviors that people have to integrate in order to be successful. And so because of a number of different things related to our healthcare system and people's experience with food and the individual components of the treatment strategy that you have to apply, I think there's this sort of imbalance in terms of the role of a medical professional in helping to guide treatment strategies for individuals who are wanting to be successful with weight loss. It's just like financial planning, right? You can do a lot of different things on your own. You can read some books. You can, go to a friend. But you can also go all the way up to a professional who's been doing it for a long time and's got a established track record, and you can entrust your resources with that person.
Sure.
Weight management really is not very different than that. And some people will probably do just fine on their own or with a commercial program like Weight Watchers or Jenny Craig or something like that.
Mm-hmm.
But then there's a group of people who we deal with in the Weight Management Center who we sort of see as they've crossed the line where medically they have more complications, they have more challenges with losing weight, they need more resources, more support, and maybe they've tried lots of times, or maybe they've always had difficulty initiating weight loss, or they've lost it but have been unable to keep it off. Those are folks who then benefit from this type of professional help.
Gotcha.
And support, and that helps sort of cut through that clutter. Because it's totally confusing in the marketplace, and I think even the best of us, in terms of who spend our time doing this on a regular basis, find this is really challenging.
Yeah, I could imagine. So we'll talk a little bit more about the Weight Management Center here at Wake Forest Baptist now. I wonder if some people might think they jump to when you start talking about medical weight loss or medical weight management, their first thought might be, surgery. So if I have doctors involved, there's going to be maybe some sort of surgery. Okay. So we have surgical options and solutions for patients, but then we have non-surgical solutions and programs as well. So maybe just talk about both of those pillars, if you will, for a minute.
Yeah. So we think of it really as a continuum of treatment, right? Again, I'll use another analogy. So cardiology or heart disease is a good example. So you have cardiologists who use the tools that they have. They don't do surgery. They might do procedures, but they often deal with medication and management of medication to help treat or prevent heart disease. But then you also have cardiothoracic surgeons who, if disease progresses to a certain point, can get in and sort of reroute the vessels and, sort of help take over management in their indications for when a surgeon would be involved. So obesity treatment is really not very much different than that, in that there is a continuum of treatment options, and that goes from what we could think of as medical or non-surgical treatment, where we're using lifestyle intervention, and that includes things like changing your diet and being more physically active in the right ways, counseling with a behavioral specialist, using pharmacotherapy, medications that can help people lose weight, and putting all of those pieces together, specialized diets. And then if those things aren't working for the person to get the type of treatment effect that we want, then we can escalate to different options, and that can include devices, implantation of devices like a balloon, or surgical treatment, where here at Baptist we do sleeve gastrectomy, Roux-en-Y gastric bypass, and a duodenal switch. So those are the three primary procedures that our surgeons do. But those surgeries are really tools that you're using to help make the lifestyle component stick, right? It's just the whole idea is, let's come up with a plan that makes it easier for you to implement the dietary plan that we want to implement. I wish we had a surgery for exercise, because then, man, we'd be killing it, right? But there's nothing that can make you exercise, right? There's no pill that makes you exercise.
Sure.
Most of that is going to be, giving you some better tools that help you enjoy that more, or giving you some time management strategies so that you put that into your schedule. But that's how medical and surgical programming works together, right? It's really both of our teams are really sort of working in conjunction, and often we're working with the same patient in a coordinated plan.
Sure. Well, talking about the medical weight management, the non-surgical options, I visited the Weight Management Center in Winston-Salem this week, and I was really impressed. Got to hear from one of the nurse practitioners, and she did a great job explaining the different options to the group that was there. And the non-surgical options, I think two of the more popular programs are the By Design OptiFast and By Design Essentials.
Right.
And if you could just briefly explain those two programs, and then maybe talk about also the 4 different pillars, right? So it's not just a medical professional. It's not just an exercise guy. It's y'all really approach it from a holistic, integrated, comprehensive standpoint with the 4 different pillars. So if you want to talk about that for a minute, I think that'd be real helpful to the listeners.
Yeah. So I usually sort of describe our 2 programs as sort of base models of a car, right? Everything that we do is going to be individualized and tailored. So you would have heard that person that introduced those programs to you talk about the idea that we're going to do a full assessment and then take the things that we learn about you, both medically, behaviorally, your background, your goals, put all that together to come up with a specific treatment plan. But we start out with 2 types of programs that we use to then customize. And so those 2 types of programs, as you mentioned, are our Essentials program or our OptiFast program. Mm-hmm. The Essentials plan is really designed for those individuals who need to lose about 1 to 2 pounds per week over a 6-month period of time. Usually that's going to lead to somewhere around 24 to 40 pounds of weight loss for the average person. Okay. And the idea is that we're starting with some basic skills around food and being able to engage with food. You're going to be doing some meal preparation and meal planning with the help of the dietitian. You're ready to shop for your groceries and put together, those types of things. We're really focused on disease management and resolution of disease. So if you come in with high blood pressure or diabetes, we're going to focus the dietary plan so that it's specific for those particular disease issues. Okay. So, even before you start losing a lot of weight, you're already starting to see improvements in those numbers. So a lot of what we want to focus on is not just the weight, but, making you healthier overall, getting rid of disease. So the Essentials plan is really sort of designed to focus in on that. It's good. It's good for that person who's ready to engage with food. It's not so good for that person who hasn't, turned on their stove in the past 6 months.
Gotcha.
Right. If you're eating out every meal, if you've got no skills around food, we're not going to turn you into Betty Crocker right away. Right.
Okay.
That's going to take some time to sort of learn those skills and get comfortable with that. The OptiFast plan, by contrast, is really a more intensive type of treatment strategy designed to help people lose at least 50 pounds or more. Mm-hmm. And it starts out with the use of meal replacements. And you use the meal replacement as a substitute for food. It's like we call it a vacation from food. So think about it like this. If
vacation from food.
Yeah, yeah. Because a lot of times what ends up happening is people are struggling with the substance that they're then supposed to use to help them get better. Yeah. Right. So think about it. If one patient I heard do a testimonial once, he talked about how his life revolved around food, and he would go to a restaurant, order 2 or 3 entrees, and his wife would say, "Hey, if you just ate a little less of that, right? You just order 1 entree, instead of 2 or 3, you would start losing weight." And to him, that was just sort of a foreign concept. That was like telling a crack addict, like, "Hey, just have a little bit of that crack, right? And then you'll get better." Gotcha. And so for a lot of people, it's an all or nothing proposition, right? Mm-hmm. If I'm going to have 1 donut, I'm going to have the whole dozen, right? If it's there, I'm going to eat it. Sure. And so this notion of moderation and trying to make these small changes, for some people, it's very difficult. And so, we say this is, again, an individualized approach, and it's not going to be for everyone, but a lot of people will find, will resonate with them when we say, look, you won't have to make choices, you won't have to deal with, cooking, you won't have to deal with that planning aspect of this process right up front. We're going to give you some time to at least get the momentum going in terms of weight loss, and then using the meal replacements, and then over time we're going to gradually rebuild your diet by adding back food in a very systematic and thoughtful way with the support of our team to help you continue that weight loss. And now at the end of this, you've essentially rebuilt your diet to be more specific for you and allow you to maintain your weight loss.
Sure. And I thought it was really helpful, and I haven't gone through the program myself, but I'm assuming just having the 4 different disciplines there to help you. And it sounds like they're really there in a strong support system kind of way with, you're touching base with them on a weekly basis. There's an app that you're logging your food and your exercise on that your support providers at the Weight Management Center are going to be talking to you about and offering you encouragement or some medical advice on how to keep it going, or if there's ways to improve it as you go through this journey in the program. And I like that that's not just you're going to see a doctor or nurse practitioner, but you're also going to see a registered dietitian. You're going to see a behavioralist, which I think is a really key component, and as well as an exercise specialist. And I like the behavioralist because you hear a lot about stress eating, or once you get in there and start unpacking, there's mindful eating, but then there's mindless eating, and some of the different ways of why people make the decisions they do. So I like how the behavioralist is a part of the program.
Yeah, I think the key to our success and really what differentiates us compared to anything else that you can find out there is the fact that we do have this team approach with covering all those bases in terms of understanding not just what to eat, but how to put the plan together, how to exercise properly for weight loss, and getting the medical advice and support to help manage chronic disease with the potential for medication treatment and so forth. If you think about it, what most people end up doing when they sort of set this resolution at the beginning of the year now to go out and lose some weight, they 90% of people start off with, okay, I'm going to get a gym membership, right? And unfortunately, I'm going to really hurt a lot of people's feelings now. You just don't lose a lot of weight with exercise alone, right? Men can do a little bit. Women generally not much. Sorry. So it's just yes, it's good to exercise because it's good for your heart and it's lots of other helpful benefits like your mood and so forth. But if you just go get a gym membership alone, probably not going to lose a lot of weight on average. And then a lot of people will say, okay, well, maybe I'll meet with a nutritionist or get something online or pick up a book to help me sort of figure out what diet plan to do, right? So now you're trying to piece something else together. Very few people talk to their physician or healthcare provider about the idea of losing weight. Sometimes I think a lot of people don't realize like, oh, my healthcare provider might be able to help me. And sometimes that's true, right? They may not be equipped to help you, but they could at least refer you into a center like ours if you're interested in that kind of support. And then, as you said, from a behavioral standpoint, very few, if any, people are really sort of attending to, I know what to do, right? I know I should, when I go to Panera, I should get the, apple instead of the chips, right? But how many times out of 10 do I get the apple, right? And does that depend on my mood that day? Yeah. Does that depend on whether I want those chips as a reward or I just fiending for some salty crunchy?
Yes, they taste so good.
Yeah, they do. And if you could get a second bag, you might. So, it's trying to figure out how to implement the plan or the thing that to do. Yeah. And that's where our behavioral team really sort of comes in there to really kind of help us connect those dots. So I can't imagine it doing it any other way because it's already hard enough as it is. And if you don't have all of that expertise and support to really help you figure it out, then I know why it's so terribly difficult for people, and they feel frustrated and they feel like, nothing's worked for me. Well, sometimes you just haven't had the right treatment.
Sure. Well, as we wrap up here in a minute, I do want to say I just encourage if there's someone that's listening to this podcast, it's not. I think for some people it could be daunting if I have to take this step to have medical weight management or weight management, supervised by doctors. I just want to encourage people that y'all are nice. You don't bite. Go by and listen to, you have info sessions that you do regularly,
That's right.
Correct?
That's right.
And listen to what they have to say. They're really encouraging and supportive. So there's just great information just by going to the initial info session, and of course very well equipped to answer questions and talk about your specific situation, whatever that might be. I do want to go into, I guess, a little bit of the shameless plug portion of our podcast. There is a really easy way to get a hold of y'all at the Wake Forest Baptist Weight Management Center. You can give them a call at 336-716-6099. Also encourage everyone, if you go to the wakehealth.edu website, you can just search weight management and that page will come up. There's a really great testimonial video from a gentleman named Chris. Mm-hmm. And I, working in the health system, I see a fair amount of videos or hear patient testimonials. But I was really struck by his authenticity and just how it just really transformed his life for him and his family. Yeah. So it's a great video to go check out. I encourage everyone to do that. Also, want to point out, so it's not just Winston-Salem, but we have an office in Winston-Salem, but an office in Greensboro as well, correct?
That's right.
So feel free, if you're just in different locations across the triad, to check us out. So, Dr. Ard, what's a closing thought you have for us? A nugget of inspiration, or just something random and funny?
I will add to that around the location. It made me think about the idea that, people are really busy these days. Yes. and you got lots of obligations and trying to make your lifestyle change and be healthy and get engaged with our program is definitely going to require some time and effort. But we do everything we can to make it easy for you. We even have virtual versions of our program. So basically you can do 70% of what you need to do by video visit.
Oh, wow. Okay.
All right. So even if you're not in Winston-Salem or Greensboro, but you're coming from somewhere north or south or east or west of here, and you want to participate, totally able to do that. All you need is a smartphone or a tablet or a computer.
So I can just jump on and do video chat with one of my providers.
That's right.
That's awesome.
That's right. Yeah. So we've got a lot of people who engage in the program that way, and I think they find it, terribly useful. And even for people who are local, just knowing that, I've got a 20-minute visit, but I don't have to spend 40 minutes in the car, going back and forth, is a real time saver. And so that makes a big difference in terms of thinking about engagement. So I would encourage people who are, sort of listening and wondering like, I don't know if this could be useful for me or not. Like you said, check us out. Come to an information session. It's no obligation.
Sure.
You at least get, entertained for 45 minutes. And we'd be happy to, answer any questions at the time. You get to meet the providers. We're the ones who are doing the information session, so you can ask us directly any questions that you have. Be more than happy to talk to you.
That's great. That's awesome. Dr. Ard, I really appreciate you taking the time and talking to us today. I know, getting healthy or losing weight, that's on a lot of people's minds at the beginning of the year. So this was great information that you provided to us. I appreciate it.
Yeah. Thank you for having me.
All right. Well, once again, this is our first Best Health podcast. We'll be doing one each month. So I encourage y'all to come back and check us out again next month with our next special guest talking about Heart Healthy for February. So really appreciate you guys taking the time to listen to us. And once again, don't forget to go to wakehealth.edu and check out the Weight Management Center. Also, there's a lot of other community wellness resources with wakehealth.edu/besthealth with our Best Health Wellness program. So feel free to check us out on the internet. Hope you guys have a great week, month, and we'll talk to you guys again soon. This is Justin Gomez with Best Health on Wake Forest Baptist Health.
Thanks for listening to this episode of the Best Health Podcast, brought to you by Wake Forest Baptist Health. For more wellness info, check out wakehealth.edu and follow us on social media. Wake Forest Baptist Health, the gold standard of healthcare.